All right. Hello, everyone. A blessed Saturday morning to all the pet parents out there. Here we are again in another episode of Maxime Talks, where we talk about relevant matters about your dogs because your dogs matter. I am Dr. Raniel Montero, your host for this morning. So, previously, we were able to discuss top things to know about canine parvoviral disease. So, to quickly sum it up, we learned that parvoviral disease is a disease most frequently seen during puppyhood or at the ages of 4 weeks to 6 weeks. And it is transferred to your dogs when they sniff and lick a parvo-contaminated surfaces or if a parvo-infected dog has a direct contact with your pets. And also, we can observe inappetence or walang ganang kumain, lethargy, or general weakness, and then vomiting, and of course, the very pathognomonic sign ng canine parvovirus, which is bloody diarrhea. When you observe all those things, all you need to do is immediately bring your pets to the nearest veterinary clinic for the immediate veterinary care. And of course, for prevention, we were able to learn the only one thing that can prevent this. It is through vaccination. So what are you waiting for, guys? Bring your puppies to your veterinarians and schedule a vaccination for your pets. And one last thing, parvo is a fatal disease for all the dogs. Pero we were able to learn that it can still be treated and it can still be managed. And of course, to show you guys that parvo can be treated and managed, we have invited Dr. Ronald Polanco of Dr. Love Animal Clinic in Project 6 Quezon City to share with us the story of Nami, a parvo survivor. So come on, let's all watch the vid.
Hello everyone, hello for parents. I'm Dr. Ronald Pulanco of Dr. Love Pet Clinic, and today I just want to remind everyone that parvo disease is a fatal disease, but it is curable. And because of that, I want to share a beautiful story of our baby Nami and her recovery from the disease. For parvovirus prevention, vaccination is a must. Do good for your doggos, feed your dogs maximally.
All right. Thank you, Doc Ronald, for sharing the successful journey of Nami to recovery from parvoviral disease. And again, it will still be the combined effort of you guys, the pet parents, and us, the veterinarians, to successfully combat this disease. So early detection will always mean higher chances of treatment success to any kind of disease, including this disease, which is canine parvovirus. So to all of our viewers, please don't forget to send in your questions. Don't hesitate to ask us anything you want to know about about our topics for today, and we will answer all your questions. So please write your questions in the comment section and get a chance to win 1.5 kg of Maxim Elite and a 500 peso discount voucher that you can use on all veterinary services in your veterinary clinic of choice. All right. So from one infectious disease to another. So for today, we have with us again our mainstay resident Dogo expert, Dr. Jomer Castro of Consulta Vet Animal Hospital, to share with us his expertise and to help us in understanding our topics for this day. So hi Doc Jomer, good morning, and we have a very exciting topic for today's episode, Doc.
Yes, a pleasant good morning, Dr. Raniel. A pleasant good morning to everyone, to all our viewers. And again, I welcome everybody to Maxime Talks. I'm so excited today to discuss new topics. This is our second episode, and I'm looking forward to answering all your questions.
All right. Thanks, Doc. Our two topics for today are very, very timely, no, since we're experiencing now we're in the midst of the rainy season. So, Doc, let's start by knowing what really is canine distemper.
Yes. Again, good morning to everyone. I want to discuss to you. I know this. You know this disease already. Canine distemper is a very scary disease that happens in dogs of all ages. So, if there was a COVID, if there is a COVID for dogs, I want to tell everyone this is it. Canine distemper. It's considered for me COVID in dogs. Why? Because it's very, very deadly. Number one, the virus affects dogs respiratory. So I'm mentioning earlier, it's like COVID, so it's respiratory. You can acquire, your dog can be infected with canine distemper through respiratory signs. Okay, you can get it. It's a multi-systemic infectious disease. What do we mean by that? It means a lot of your organs are affected with this. It can affect your respiratory, it can affect your intestinal, and it can infect your brain. So this is why it's called multisystemic. Okay. What does it do? What does it do? Okay. Uh, at first glance, you would notice coughing and colds in your dog. And as written here, as you can read here, meron pong discharge that you can see from the nose and from the eyes. The most common that you would always ask me, Doc, what's the most common sign? The most common sign is, grabe po magmuta yung inyong aso. It's very exceptional. Talagang you can clearly see an excessive discharge from the nose and from the eyes. Okay, hindi po to simple lang. You can see a lot of discharge coming out of the nose and coming out of the eyes. Okay, who are prone to get a canine distemper? Okay, what's really deadly about this disease is lahat po ng ages ng aso ay pwede pong mahawa sa ganitong klaseng sakit. Ibig sabihin po, if I discussed this before, parvo can only affect puppies of a certain age, very young animals lang. Dito po sa canine distemper, pwede pong magkasakit ang inyong tuta at pwede rin pong magkasakit ang inyong adult dog. So all ages po pwede pong mahawa. Next
All right,
is,
Doc. Thank
okay,
you. So yun, we were able to finally distinguish no kung ano yung difference ng canine parvovirus and canine distemper in terms of age group ng mga puppies or ng mga dogs sa tinatamaan. So kanina nabanggit niyo, Doc, na ang canine parvovirus na tinatamaan usually yung puppies. But for this disease, canine distemper, all ages, all age type talagang
yes.
tatamaan ng aso. So Doc, next natin, we want to know no kung ano ba yung mga signs and symptoms of canine distemper. Kasi I believe we have two stages, eh, 'di ba, right, Doc? Stages
Yes.
ng disease na to.
Opo. Whenever your dog gets infected, I hope not. I know this is a deadly disease. There are two stages that you will see. Actually, three stages, mostly, but most commonly, there are two stages into the disease. Okay, one is the respiratory stage. Okay, katulad po ng na-mention ko earlier. If you feel that your dog has an exceptional cough and an exceptional cold, okay, Yun po kasi yung pinakaunang dapat yung manotice sa dogs ninyo. If yung cough niya it's not just a normal cough. It's not just a normal cold. Okay, kasi pagka simple basic cough lang and cold, there is really no excessive discharge. But in canine distemper, at an early stage, you will always see an excessive nasal discharge. Katulad na sabi ko kanina, maraming lumalabas na sipon na may plema. Makikita nyo, it's kind of a yellowish, greenish discharge. And severe po yung eye discharge. Ibig sabihin po, grabe yung pagmumuta niya, which is very, 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 very distinct in canine distemper. Now, besides that, meron pong fever. Okay? Meron pong panghihina. Meron pong hindi po siya kakain syempre. If your dog is experiencing excessive cough and excessive colds, hindi po siya kakain. And the next thing is vomiting. Magsusuka na po ng paulit-ulit ang inyong aso. Ngayon po, pag nagsusuka na kasi, definitely your dog will not eat. Okay? Yan po yung early stages that you have to be aware of. Kailangan po mabantayan nyo to Mabantayan nyo in your puppies. Kasi po, once na meron na kagad kayong napapansin na unusual colds and cough, you have to visit the vet. Okay? Don't wait because it will only take a few days before your dog progresses into a late stage or a chronic stage of canine distemper. So, when you feel and when you think na meron pong kakaibang ubo at sipon yung aso ko, kailangan dalhin ko na siya sa vet. Lalong-lalo na po kapag wala siyang bakuna. If he doesn't have shots. Okay? We will explain to you later on the next slides with Dr. Raniel on the vaccination of dogs later. Okay?
That's right.
Now, going to the chronic stage, most of the time when your dog gets the exceptional cold and cough, it will progress. I hope not, but it usually does. Okay, when you do not medicate immediately, it progresses to a higher stage. Ito na po yung nangyayari. Okay, ang nangyayari po sa kanya, nagkakaroon po siya ng muscle twitches. You would notice gumaganon po yung aso ninyo. Bakit po? Bakit po gumaganon? When the virus reaches the nervous system, it goes to the brain. It's like rabies, guys. Rabies goes to the brain. When the virus, the canine distemper, reaches your brain, it causes mild encephalitis. Okay? When it reaches the brain and reaches and causes mild encephalitis, your dog experiences tremors. Okay? Tremors, nervous fits ang tawag nila. So nagjo-jerk siya, yung ulo niya gumaganyan. And nagkakaroon po siya ng seizure. A seizure is really very, very also unique in canine distemper because whenever it reaches the brain, ganun na po ang nangyayari. Ano po ba yung seizure? I know seizure, it's like meron pong tinatawag sa tao na seizure na pagka meron pong seizure, nanginginig po inyong aso. There's a video that we want you to watch.
Yes, Doc.
Of a dog
Be
having
prepared
a seizure.
to video. Yes, Doc. All right.
Usually it cannot stand up. Naninigas po. Ayan po ang seizure na makikita, especially in canine distemper. It's very unique. Ayan po. So you have to be aware of what you should do, and you should be ready that you should put your dog on an open space whenever this happens. You don't do anything. Okay? You just let it happen because it will stop. Okay? It will just take a few seconds to a minute. It will stop. Then you have to clear anything that your dog might hit. Kasi baka mauntog siya, baka may pointed object, matusok siya. Kailangan, you have to put it in a comfortable open space. Okay? mas maganda po if you have a bedding for him because pagka nag-seizure, naninigas po siya. So ganito po ang nangyayari.
Yes, that's right, Doc. Very important yun, ano? Kasi pag nandito na sa stage na to yung aso, there are no turning back. It's
Yes.
irreparable na. So, the only thing that you can do is to properly manage yung seizure niya para hindi na magkaroon ng further injuries, ganyan na pwedeng mangyari sa dogs.
Yes. You should be ready whenever this happens. So you have to prepare, okay, for the welfare of your dog whenever this happens. Okay?
Yes, that's right. Doc, we might have missed a vital part of this disease. So we just want to ask then on how this disease, canine distemper, can be transmitted to the
Yes.
dog.
Okay. Uh, this is very important because you have to be aware on how this problem is transmitted from dog to dog. Okay. So on the early stage, when your dog exhibits eye, ocular discharge, and nasal discharge, he can pass this on through the saliva, through the wee-wee, yung urine, and through the blood. So whenever you have a litter and they share a food bowl, whenever they share food in a container, or whenever they lick each other, this virus can be passed on through the discharge. So, like I mentioned earlier, di ba, parang COVID, whenever a dog sneezes, a dog coughs, he transmits it. Kasi aerosol spray, parang COVID nga po, like I mentioned earlier, napapasa po to airborne. And this is very, very difficult to stop. Okay? So you have to, whenever you suspect pa lang ha, ibig sabihin, if naisip nyo pa lang na baka may distemper po yung dog nyo, you have to isolate your dog. You have to remove it from the litter, remove it from the kennel, and quarantine your dog. Diba? Parang matatawa ka eh, kasi parang talaga siyang COVID. So, you have to know what to do para po you do not pass this problem to your other dogs. Because whenever they get it, your kennel will be wiped out because of this problem.
Yes. Oh, okay. That's right, Doc. No, we just want to reiterate na yung canine distemper is transmitted airborne. So that's
Yeah.
the big difference from canine parvovirus. So that makes it more contagious than the canine parvovirus. So Doc, we have here some questions. Okay.
Okay.
So first question, can all excretions like vomit, feces, and urine from an infected dog can contain the distemper virus?
Yes, definitely. These are the main sources of infection. So whenever your dog is already infected with the virus, you should avoid them transmitting through the saliva, through the feces, through the urine. Because itong discharge na to are shed through that medium, through the discharge. Dun po nila na-shed yun. Yun po ang nakakahawa. So you have to be careful with that. Kaya nga po, hinihiwalay yung aso, ina-isolate siya, para yung mga discharge niya, like vomit, feces, and urine, hindi niya po ma-shed at maipapasa sa iba pong aso. Yun po ang pinaka-importante. I hope I answered that question, Doc.
Yes, I think Doc, we clearly answered yung question. So one last question for this segment, Doc. Although we were able to answer this na kanina, I think baka may nakamiss lang no nung information. Can adult dogs still contract the disease?
Yes, like I mentioned earlier, this problem happens in all ages in dogs. Puppy, middle age, adult age, senior age. So whenever your dog is not protected with a vaccine against canine distemper, your dog will acquire it whenever he is not vaccinated. So you should be careful with that. Okay?
Yeah.
Kahit
All right.
matanda na po, magkakaroon.
Yes. Thank you, Doc, no, for answering all of our questions for this segment. So, before we proceed, I would like to again invite everyone to just put in your comments or your questions in the comment section below, and we will try to read it during the webinar, and we will answer all of your questions. All right? So, thank you, Doc, and I think we were able to answer no, yung mga questions. And, okay, moving forward, since napag-uusapan na natin yung vaccination kanina, it is just right to know kung ano yung mga precautionary measures that we can share to our pet parents here to know how to prevent nga their dogs from getting this infection.
Yes, as we all know, this is a viral problem, and most of the viruses don't really have treatment. They don't really have treatment, and we can only give supplementary medicines to support secondary bacterial infection para pag bumaba yung immune system ng aso ninyo, you can protect your dog. But the main thing and the most important thing that you have to prioritize in your dog is you have to complete and update their vaccination. There is no other way for you to stop, control, and prevent the virus from reaching your dog except vaccination. So there's a schedule that you should follow. You should always remember this at as early as 6 weeks. Kailangan pong pabakunahan ang inyong mga alaga against canine distemper. It's included in the vaccination program of 5-in-1, 6-in-1, 7-in-1, or 8-in-1. You should always consult your vet regarding that. Kasi without it, since this is airborne, if you say na, Doc, hindi ko naman nilalabas yung aso ko. I just keep it indoors. Your dog can still contract this virus if you don't vaccinate your dogs. Okay? As I earlier mentioned, it's airborne. Only the vaccine will prevent the problem. Thank you, Doc.
Right. Thanks, Doc, no. So, what if unfortunately naman, Doc, our dog was able to contract the virus? Can you like share, Doc, yung treatment plan na ginagawa nyo or how do you manage this kind of disease? Like for example, meron din na lang the same case sa clinic natin.
Okay. The most important thing, syempre, whenever I understand kasi most clinics, since this is a scary problem kasi it's highly contagious compared to parvo. Parvo, you can easily control it because usually direct contact yung parvo. But with distemper, it's airborne and it's really very difficult to control it dahil nasa hangin siya di ba? Na ipapasa siya. Parang COVID, hindi mo nakikita yung problema. So what we do is, syempre, at an early stage, we medicate very early in the clinic. We isolate it. We quarantine the animal and give him really strong medicines, antibiotics to counter secondary bacterial infection. Para po it will not progress into the chronic stage which reaches the brain. That's what we're trying to prevent. Okay? Pag respiratory pa lang po siya, ubot sipon, kaya pa po siya eh. If you given strong medications, you have to really consult your vet about this. Intensive care is done to cure and really control the coughing and the colds, yung severe discharge. Pag na-arrest po yun, hindi magpo-progress eh. Dahil wala nga pong gamot talaga ito. Pine-prevent mo lang, kinokontrol mo lang to progress to the chronic stage. Kasi pag dumating na po sa chronic stage, like you mentioned earlier, di ba, Doc Neil, mahirap nang pigilan eh. Mahirap nang pigilan. It's usually the dog really gets very weak pagka nag-chronic dahil nga sa seizures eh. And most of the time, they die. Pero kapag ganitong early stage pa lang, kaya pa po ito. Supportive care, like nakalagay po dito, kaya po pagka nagamot po natin yung ubo at sipon, mapipigil na po yun. Okay? There are certain treatments na medyo malalim na, intensive care nga po yung ginagawa, para po ma-prevent yung progression to the chronic stage.
All
Okay, Doc.
right.
Mm.
Thank you for your for your insights, Doc, for Canine
Mm.
Distemper. I think this ends our topic for Canine Distemper, and it's time na for all the questions that we have here. So, Doc, ready ka na ba sa tanungan natin ngayon
Yes,
about Canine
I hope
Distemper?
I can answer it, all of it. So I'll try
Oh,
my
Doc,
best.
I'm very sure na you will answer this all. And of course,
Mm.
yan. So first question, Doc. Kanina nabanggit natin yung difference nga ng distemper and ng parvovirus. So, compared to parvovirus daw, Doc, is distemper more contagious and easier to be contracted by our dogs? And why?
Okay. Uh, I think I also mentioned this earlier, but I'll repeat it. Parvovirus is transmitted through direct contact. So most of the time, through the feces, yung naaamoy lang nung nadidilaan, nahahawa na sila ng parvo. Pero once you control parvo, na-isolate mo sila, you quarantine it better, nakapag-disinfect ka, madali na pong pigilin yung problema na kumalat. Okay? The problem with canine distemper, airborne po tayo, di ba? Parang COVID, nakakatakot, hindi mo nakikita yung problema. Kahit minsan, kahit na nag-isolate ka na, pero na-expose siya, di ba? Parang sa COVID po, yung contact tracing, nahirapan tayo eh. Pag na-expose yung dog with other dogs na nakatabi niya lang dahil airborne nga, wala namang face mask yung mga dogs, right? So, they can easily contract it because of airborne transmission. So once na-inhale nila, nag-sneeze, nag-cough, yung dog na nakasama niya sa park, wala pa siyang bakuna, madali po siyang mahawa. That's the reason why when you reach home, matamlay na yung aso, may fever na, depressed na siya, lethargic siya. Then, the next stage is, magkakaroon na siya ng sipon, magkakaroon na siya ng ubo, and grabe na yung discharge. From that time on, I hope in a few days it will progress. So they can easily be infected, highly contagious because of the airborne transmission. So yun,
Yes,
Doc.
that. Thanks,
Mm.
Doc. No? And then ito, next question natin. It's siguro it's a first-hand experience from the one who asked this question. My pregnant dog is positive for canine distemper. So can she
Mm.
transmit the virus through placenta?
Yes, uh, it's already been researched in the past. There's studies that has come. The virus can be transmitted transplacental. Ibig sabihin po na ipapasa niya rin talaga sa mga anak niya. Okay, what you should do is you should bring it to a vet. Yun na nga. Dahil po may intensive care ang gagawin po sa kanya to treat the mommy dog. And once you treat the mommy dog, they will do something to really prevent and control na maipasa niya yon sa kanyang mga anak. But most of the time, what they should do is they should separate already the puppies. Kailangan ihiwalay mo na siya eh. Why? Because they will drink milk from the mommy. Eh since maipapasa niya rin yung virus through that medium pag uminom sila ng gatas. Okay? Mas maganda na i-bottle feed mo na lang muna yung puppies to prevent the transmission severely. Kasi once they acquire the virus, lalo na kung puppies, it's very, very hard to treat very, very small and young puppies against the virus because may respiratory problem na and yun ang nangyayari. And if it progresses in puppies, they usually die immediately. So you have to really consult a vet. You have to go to a vet and ask them what you should do. They will help you out with this to prevent it from progressing dahil marami pong mahahawa. Bukod dun sa nanay niya, yung puppies niya, yung other dogs. Thank you, Doc, for that question.
Alright, Doc. Thank you din kasi nag-share ka, Doc, ng tips. Kasi for example,
Uh,
may panganak na and may infected with distemper. Although
mhm.
those are good tips for our pet parents. So another question, Doc. Is it okay to give SMP tablet to treat dogs with canine distemper? Are you familiar,
Yes,
Doc, with this case?
uh, I want people to understand why SMP is. SMP is an antibiotic. Okay, it's a prescription drug. Okay, prescription antibiotic that you cannot buy easily in the drugstore. Whenever you go to Mercury Drug, they won't give you this without a prescription. But I know people try to abuse this antibiotic. SMP is a TMPS drug, trimethoprim sulfadiazine antibiotic that naririnig nila to sa Facebook eh. And just like any other antibiotic, gagana din po yung amoxicillin, gagana din po yung kung ano cefalexin or cocoamoxiclav. Iba-iba lang po kasi antibiotic and one of them is SMP tablet. Don't ever think that this is a magic drug. This is not a magic drug na akala ng mga tao kasi gumaling yung SMP dun sa kabilang aso na may canine distemper. Ito na yung gamot sa distemper. No, it's not. Okay? Sabi ko nga po kanina, there is no treatment and drug against canine distemper. Parang COVID, wala pa pong gamot. Okay? We are only trying to treat yung secondary bacterial infection. Bakit po? Pagka nagkaroon po ng distemper yung aso nyo, severe yung ubo, severe yung sipon, severe yung seizures. Okay, dahil po doon bumabaksak yung immune system niya. Mas lalo po siyang prone sa mas marami pang sakit. Ito po yung pinaprevent natin, na malalo pong bumaksak yung katawan niya pag wala siyang antibiotics. Kaya kahit ano pong antibiotics gagana as long as you consult your vet. Kasi hindi po ibig sabihin na kapag may canine distemper yung aso ninyo, SMP na yung gamot. Hindi po totoo yun. Hindi lang po naiintindihan ng mga tao na isa lang din po itong antibiotic na maaaring gumana at makatulong dun sa aso. Pero hindi po ito yung exact cure. Okay? Sana po naliwanagan ko kayo doon kasi ina-abuse po itong SMP. Akala nila ito na yung gamot na. Hindi po. Marami pong antibiotic ang pwede. Pero kailangan nyo kumonsulta sa veterinaryo para malaman nyo yung tamang paggamit. Dahil maaari pong hindi gumana yung SMP pag severe na yung problema ng inyong aso. Lalo na kung canine distemper.
Yes. All right, Doc, thank you for your insights. We just want to remind all the pet parents na ang antibiotic ay prescription drug. So you cannot buy antibiotic without a prescription letter from your licensed veterinarian. Bakit
Yes.
siya prescription drug? Kasi we are actually entering the phase of bacterial resistance.
Yeah.
So, yun, kailangan lang nating ma-prevent na maging resistant yung bacteria doon sa mga present antibiotics. So, bakit ba sila magiging resistant? Due to our abuse doon sa mga antibiotics. Dahil later on, darating yung time na hindi gagana yung mga antibiotics na yun. And we don't want that to happen. Alright?
Yes. Always consult your vet. Yun, ganun po eh. Yun ang kailangan.
Yes, Doc. So, last two questions na tayo, Doc. So, itong question na to, can distemper virus survive on surfaces? So, if yes, how long? And can we use any kind of disinfectant for disinfection?
Yeah. Actually, common disinfectants can really combat this virus. I understand the specific virus is paramyxovirus. Common disinfectants can be used for this. Actually, nag-work din po yung mga bleach. Kasi sa parvo, specific eh. Sa parvo, iba po kasi yung structure. The structure of the parvovirus has, para siyang COVID, meron siyang shell. So, gagana lang po yung bleach, hydrogen peroxygen compounds dun sa parvo. No other disinfectant. But with distemper, usually glutaraldehyde works. Alam ko, yung most common disinfectants, Lysol, can work against canine distemper. So, you don't have to worry, unlike yung parvo na mahirap pong i-disinfect. canine distemper is easier to disinfect with common disinfectants in the market. Okay.
All
Yeah.
right, thanks, Doc. So we are down to the last question for canine distemper. So, eto, is it advisable to vaccinate a dog who survived from canine distemper? And if yes, how many days can be the interval for the vaccination from the time that the dog survived?
Okay. I want you to understand that this canine distemper is a virus. Okay. So whenever a virus hits humans or animals like our dogs, we develop antibodies against it. Kapag gumaling na po tayo, for example, yung aso nyo, gumaling na siya sa canine distemper. Okay? Nagpo-produce po siya ng antibodies against it. Okay? So, hindi na po siya tatamaan ulit. Hindi siya paulit-ulit na tatamaan. Katulad po ng parvo. Okay? Pag nagka-parvo po yung aso ninyo, hindi na po siya mauulit na parvo ulit. Wala na po yun. Protected na siya for life. May antibodies na siya dun eh. Okay? So, you don't really have to vaccinate your dog against canine distemper. Dahil gumaling na siya dun, may antibodies na. Kaya lang po, kailangan nyo pa rin siyang pabakunahan kasi yung 5-in-1 has many other viruses, yung 5-in-1, di ba? Mayroon siyang parvo, may hepatitis pa, may lepto. You have to protect it against the other diseases. Eh, kasama na po dun sa 5-in-1, yung distemper. So, pag binakunahan nyo, kasama na yon. Kaya lang, manenegate na po yung distemper virus dun sa 5-in-1 kasi nga may antibodies na siya eh. So, hindi na po siya, wala nang bisa yung distemper vaccine dun sa dog nyo kasi nga may antibodies na siya. But, you have to really protect it also from other viruses na kasama dun sa 5-in-1. Wala naman po kasing nakahiwalay eh, na distemper vaccine na single na pwede nyo ibigay sa aso nyo. Wala naman ganun po. Lagi siya kasama sa 5-in-1. Okay, the problem here right now, pag gumaling po yung aso ninyo sa canine distemper, meron pong side effects na makikita sa aso nyo that he will experience in his entire life. Example, meron po siyang seizures. Meron po siyang nervous fits, yung jerk, nagja-jerk yung ulo niya. Dala-dala po niya yung epektong yun ng virus habang buhay, which is very difficult. Nakakaawa po. Kaya nga you have to prevent this from happening. Kasi, pag gumaling siya, okay, hindi na siya tatamaan uli ng canine distemper. Pero, dala-dala niya po yung sakit pa rin. Nagjo-jerk siya na gano'n, nahihirapan siyang kumain. Yun yung mga problems eh, na you have to really, and mahirap pong mag-alaga ng dog na gumaling sa canine distemper kasi meron pa rin siyang seizures, meron pa rin siyang nervous fits. Yun po ang problema. I hope I answered that question, Doc.
All right. Thank you, Doc.
Mhm.
And one thing na very, very key dun sa sinabi ni Doc Chomer is this is a forever disease, parang ganyan ng aso. So,
Yes.
dala-dala niya na to habang buhay niya. So, sa mga hindi naniniwala sa forever, this is it, guys. May forever po sa canine distemper for our dog. Okay?
Very sad.
Yes,
Okay
but
po.
sad forever. Pero yun, so from one infectious disease to another, so next topic natin would be canine leptospirosis. So, Doc Jomar, our pet parents want to know what is canine lepto and what ages of dogs are prone to this one?
Okay. Again, I want everybody to know canine leptospirosis. We're discussing this topic right now because this is very timely. Tag-ulan po eh. Kasi pag tag-ulan, uso po yung bagyo and uso po yung baha. And I know this is very important. Kasi mga alaga po niyo, lagi may pumupunta sa tubig yan, umiinom ng tubig sa kanal minsan, hindi nyo maiwasan. And comparing it with the last problem, yung canine distemper, canine leptospirosis is not a virus. This is a bacteria. Okay, bacterial problem po ito. Okay, leptospirosis ang nagdadala po, ang nakalagay po dito, zoonotic disease, meaning, okay, kung yung canine distemper po hindi siya nakakahawa sa tao, I want everybody to know that leptospirosis is nakakahawa sa tao. So that's why it's scarier than distemper. Okay? Dahil pwede tayo mahawa from our dogs. Okay? Kaya nga po, dito uso yan sa Pilipinas. Why? Because of bagyo, baha, okay? Pag lagi pong may baha, yung mga daga po, laging lalabas. Sila po ang carrier madalas nito eh. Rats. Okay? Lumalabas po yan sa sewer, sa kanal, pagkabaha. So, the main thing, we will go now to the next slide, which shows us sino ba yung at risk dito sa sakit na to. Actually, lahat tayo. All mammals can get this. Lalo na tayo yung mga tao. Pag bumabaha po, dito po nakalagay access to ponds, lakes, and streams. Because in other countries, dito po nila nakukuha to kasi bihira po yung baha sa kanila, like in the US. Wala namang frequent flooding sa mga streets eh. Kaya nakukuha po to dun sa ponds, sa lakes, at saka sa rivers. Ngayon, once an infected rat or an infected animal sheds the virus through the urine, kasi ito po yung main course kung saan niya na ipapasa yung leptospiremia, yung leptospires, na ipapasa niya po sa ibang animals ito through sa wiwi, through sa urine. So kapag ka merong urine na napunta sa flooded areas, sa baha, and meron po kayong sugat, yung aso nyo may sugat sa balat, pwede pong pumasok yung leptospires doon sa sugat. Pupunta po ngayon ito sa dugo ninyo. Okay? Dito po kayo nahahawa. Direct contact with contaminated water. And marami po yan dito sa atin, sa Pilipinas. Lagi po natin ito makikita, mahirap iwasan, lagi may baha. Okay? So, yung infected urine po, okay, makikita nyo, pag napunta siya sa sugat, pumasok yung leptospire sa blood, pupunta rin po ang main organ kung saan siya natatamaan, yung kidney po. Yung kidney. Kaya pagka ito po sinisira niya yung kidney nyo, nagkukos po ng problema din po sa buong katawan ninyo, lalo na sa liver din. These are the two organs that get destroyed by the leptospirosis. Okay? Yung kidney and liver. So yung kidney, kaya nga po na-shed out siya through the urine, yung kidney po yung main organ na tinatamaan eh. And yung liver. And what causes this problem, the most unique clinical sign that you would see, like I always say, yung pathognomonic lesion ng aso, naninilaw siya. Jaundice. This is the main sign that you would see na makikita nyo sa aso ninyo kapag ka merong ganito. Ito po, jaundice, yellow gum, eyes, and ears, and skin. When this happens, okay, this is a very severe problem already and very hard to cure and treat. Okay, so I'm letting everybody know that there are stages for this. Hindi naman po siya kagad maninilaw eh, di ba? Siyempre, ang unang mangyayari po sa kanya, magkakaroon siya ng lagnat. Katulad po kanina ng Distemper, di ba? Lalagnatin siya. Hindi siya kakain. Ganun po ang aso eh. Laging ganun eh. Pag may sakit siya, siyempre hindi siya kakain. Di ba? Mahina siya. Hindi siya makatayo. Tapos nagkakaroon din po siya ng diarrhea. Nagtatai po siya. Ganun ang nangyayari po eh. Ngayon, dahil nga po umaakyat yung leptospires sa kidney, pag tinamaan po yung kidney, ang nagiging problem po, na laging nakikita natin sa aso, kahit anong sakit po yun, related sa kidney, inom siya ng inom. Inom siya ng inom. Yun ang problema po, pagka meron kang problema sa kidney, inom ka ng inom. So, ganun po ang nangyayari. Last stage na po, when you see your dog becoming yellowish, lahat po nagiging yellow. Yung balat niya, yung gums niya, yung ears niya, yung pinna of the ears, pag binaliktad nyo, makikita nyo po, yung sclera of the eye, kulay puti, ay kulay yellow. So, ganyan po. This is not an exaggerated picture, but it is true. This is what happens when your dog gets lepto. And if this is systemic already, nanilaw na siya ng todo, mahirap pong habulin, mahirap i-treat, and most of the time they die. Mahirap din pong ma-cure yung ganito if it reaches a very late stage. Okay?
All right, Doc. Thank you for your insights. And of course, um, like any other diseases, Doc, prevention will always be a paramount concern ng ating mga pet parents. So how can we prevent this disease, Doc, from infecting our dogs?
Okay. So most of the time, again, eto na naman si Doc, mangungulit sa inyo. Vaccination na naman, yeah. Because this is the most important thing. Prevention is always better than cure. And it's cheaper, by the way, for everybody to know. It's cheaper to always vaccinate, okay? There are new vaccines right now available in the market. Unlike before, it's just 5-in-1. Now there is 8-in-1. Why is it 8-in-1? There are additional leptostrains included in the vaccine. Okay? Before kasi ilan lang po yung strains na nakalagay po dun sa bakuna na 5-in-1. They made it 8-in-1 right now, which is very, very important in your dogs. Kasi po, yung bacteria, yung bacteria mabilis din po mag-mutate yan . So marami pong strains ng Leptospira na meron na po dito sa mundo, nadadagdagan po yan every now and then. Kasi, di ba, yung bacteria nag-mutate din. So, dumadami po. So, ngayon, nakapag-create sila ng vaccine against it, 8-in-1 na, para mas lalong protektado ang inyong aso against Leptospirosis. So, kailangan, you should always consult your vet, syempre, para dito, kasi for you to understand na, lalo na pagbahain sa inyong area, kailangan po maganda yung vaccination program ng inyong mga aso. Right, Doc? Di ba? Tama naman, Doc.
Yes, that's right. Very common kasi ang baha dito sa Pinas. So, most likely, dapat talagang kompleto yung bakuna ng alaga nating aso. Okay. Next slide po.
Yan. Now, this is also very hard to avoid kasi syempre, I have lots of dogs. I have Jack Russell Terriers. And they're very, very makulit, di ba? They're makulit sila. They will always chase rats. And it's very hard to stop them, lalo na if they want to chase it, they will kill it. And they will bite it until it dies. Talagang papatayin nila . So, better for you to isolate your dog for them not to really come into contact with rats. Kasi yung wiwi ng rats, pag infected yung rat, doon nila makukuha yun . Pag kinagat nila yan, makakain nila yung rat, maiinom nila yung wiwi dahil nga nakainom sila ng tubig sa kanal na merong So, a lot of problems arise from that. So, ito yun . Dito talaga nila nakukuha to . So, what we use most of the time is whenever a patient of mine comes into the clinic and tells me that his dog chased a rat and killed it, we revaccinate. That's what we do. Yun yung advice ko to other dogs. Kahit na siguro nagiging twice a year na yung vaccinations nila kasi it's really very hard to prevent a dog from chasing a rat. So, if you can stop them, okay, pero kasi minsan mahirap iwasan dahil pag bumaha, di ba, lalabasan yung rats, ayan na tuloy, hahabulin na ng aso, magkakasakit sila. Vaccination is still the best, but if you can do this, well and good. Okay.
Alright, Doc. So, yun, avoid flooded areas daw. Doc, madali ba tong gawin na ma-avoid natin?
Yeah. Alam ko, I know, this is really a very, very big problem. Kahit tayo mga tao ibig sabihin, pag binaha tayo, di tayo, exposed na rin tayo sa lepto dahil nga nasa baha na rin tayo, hindi lang yung aso So, it's better to always, put them on higher ground kasi minsan madali lang yan pagka hindi sila nababaha, naka-cage lang sila, 'di ba? Ang gawin niyo na lang po, 'di ba? Ilagay niyo sila sa isang mas mataas na lugar para naka-cage naman sila eh. So, 'di ba? Pag naka-cage sila, di hindi sila maaabot ng baha, hindi sila magkakasakit, 'di ba? Yun lang yun eh. So, pero yung people are still exposed to the floods. Kailangan tayong mag-ingat, 'di ba? Kailangan din tayong mag-ano, 'di ba? So there are medicines, preventive medicines, ang tinatawag namin diyan eh. Prophylactic medications in dogs. There are medicines available. You have to consult your vet, go to your vet, ask him about this kasi nga napunta sa bahay yung aso ninyo. Mahirap po iwasan yung bahay, pero hindi naman tayo pwede lumipat ng bahay, di ba? So, yun na lang po. There, always consult your vet. Pagka nabaha, naghabol ng daga, at nakainom ng tubig na kanal, yung inyong aso, you have to consult your vet regarding this. Okay?
Yes, that's right, Doc. So, prevention will always start with proper nutrition. That
Yeah.
is what Maxime Elite offers to all of the pet parents and of course to our fur babies. So Maxime Elite is jam-packed with all the nutrients that we need para lang ma-prevent natin and to keep up with the proper nutrition for our dogs. All right, it starts from puppies. We need to give them DHA, which Maxime Elite has. So DHA for yes, for sharper mind, and of course, omega-3 and 6 for healthy skin and shiny coat. So ito, meron din tayong prebiotics. This is for the better absorption of nutrients sa gut. And of course, we also included antioxidants to support the immune system of your dog. And of course, since medyo issue din ang allergies for our dogs, we also included multi-animal proteins to reduce the possible risk of food allergies. And syempre, we don't want a smelly odor. So we have included yucca extract to control the stool odor of your dogs. So guys, what are we waiting for? Let's give the proper nutrition that our dogs deserve. Feed them Maxim Elite dry dog food. Right, Doc?
Okay. Siyempre, optimum health should always be there. And siyempre, a vaccine is incomplete if your dog is not healthy. Diba? You cannot give vaccine. So, whenever, to achieve optimum health, siyempre, you have to give the best dog food. So, Maxime really helps in all of this kasi we can never achieve optimum health without proper nutrition.
Yes,
Okay.
that's right.
Hmm.
Thank you, Doc. So, Doc, ito, no, kasi, for example, hindi na natin na-prevent yung canine leptospirosis. Doc, can you like tour us doon sa diagnosis and treatment plan that you usually conduct if you have encountered canine leptospirosis on your clinic?
Okay. So right now, whenever a problem arises regarding a patient comes in and na-diagnose namin na merong leptospirosis, also, I can also mention to you guys that we do intensive care depending on the stage that they're at, which infection is really bad. If it's really bad, if it's in a late stage, a chronic stage wherein, yellowish na, we still try our best. But with treatments, syempre we give intensive care, IV fluids, we give antibiotics, specifically penicillin, streptomycin, and other leptospiremia specific antibiotics to really counter the problem. And also supportive treatments and vitamins and syempre proper nutrition to really combat this problem pagka may sakit na. Pero kung pagdating po sa clinic, what we do is we confirm yan through the lab test. There are test kits that are available, rapid test kits, ELISA, that will confirm the problem kung leptospirosis. Pero I want everybody to know na hindi lahat po ng naninilaw na aso leptospirosis na. Hindi po.
Yeah.
Marami pong, baka po kasi isipin niyo naninilaw na lang yung aso ko, nabaha na kami, akala nyo lepto na, hindi po. You still have to go to your vet. You have to consult your vet. They will do a test. Kailangan pumunta, i-confirm nyo Kasi may specific na gamot po eh. May specific gamot. Don't attempt to really just treat it at home. Kasi nga, this is a serious problem. And if you treat this at home and you just treat your dog at home, delikado rin po yun kasi nagsished yung aso nyo ng leptospirosis. Diba? Leptospirosis. So yung leptospiremia, kinakalat po niya yan na maaari kayong mahawa. Okay? I'm not scaring you, pero I want you to know. You have to bring it to a vet. No, marami tayong hindi naiintindihan dito. Isipin niyo po mabuti din yung kalusugan ninyo. Dahil baka mahawa kayo pag tinitreat nyo lang sa bahay yung aso nyong may lepto. Okay? Antibiotic treatments will help kasi responsive po. Madali din naman siyang gamutin compared sa canine distemper. Mas madali siyang gamutin dahil nagre-respond. Dahil nga bacteria po ito, nagre-respond siya sa antibiotics. Okay? Kahit sa tao po, madali na rin gamutin ito basta wag lang late stage. Magre-respond po yung tao sa antibiotics. Okay? You can consult your physician regarding that. Pagdating naman po sa aso, may mga gamot din po na madali na silang mag-respond. Antibiotics din po yun. Kaya kailangan, dali nyo sa vet. Pero before po umabot ito sa grabing sakit na lepto, bakuna po. Papaalala ko na naman, ito na naman si Doc, nangungulit. Vaccination is always a must. Priority for your dog, not just for lepto, for other diseases. Okay? 8-in-1 na nga po, sabi ko nga. 8-in-1 na, wala na pong problema. Isang bakuna lang kada taon. Protektado po ang inyong aso. Kahit mabaha kayo, madaga kayo, or kung ano pang problema dumating. Vaccination is still priority in your dog, for your dog.
All right, Doc. So, Doc, we have here 2 questions for canine
Okay.
leptospirosis. So, first question, can my dog get leptospirosis if he ate or bit a rat? What about if the rat bit him?
Okay, that's a very good question. Actually, may nakwento na ako earlier about this. Okay, I have a patient before who did this. Kasi it's a Jack Russell also. My dogs do this all the time. Okay, so most of the time, whenever they eat it, okay, what we do is we do a prophylactic treatment. Okay, we give in. You have to go to your vet. You have to go to your vet. Ipapaliwanag sa ito. Maaaring yung regimen po ng vet is babakunahan siya ulit. Okay, may second vaccine for the year against lepto. Kung hindi po 8-in-1 yung ibinigay sa example, yung first shot niya is last year is 5-in-1, incomplete po yon sa lepto. So kapag naghabol yung aso mo ng daga, tapos iti-treat nila yan, may prophylactic treatment, antibiotics, and there's a program that they do. You have to consult your vet, and they will revaccinate your dog with 8-in-1. Okay? So yun ang mga gagawin po sa aso ninyo to prevent it kahit na walang lepto yung daga. Kasi we cannot confirm if there's the rat that he chased, walang lepto, di ba? Hindi naman natin mako-confirm yun. So let's just assume na lahat ng mga dagayan madumi, baka may lepto sila. So, gagamutin na natin yung aso. So, dadali mo siya sa vet. Okay? Ngayon, kung kinagat naman siya, wala namang problema po dun sa kagat eh. Kinagat siya ng rat. Okay? You just have to treat the wound. Okay? Treat the wound. And you have to go to your vet. They will explain it to you. And they will advise if he needs another vaccine or he needs antibiotics or other supplemental medications para hindi siya magka-lepto. Explain po ng vet yun. Okay? So, you have to always bring it to a vet. Don't medicate at home on your own because lepto is not an easy problem to treat. Okay? So, again, may prescription drugs po ito na vet lang, makukuha nyo lang sa vet. And you cannot buy it just outside sa pharmacy without a prescription. So, tandaan nyo po yun. Thank you, Doc, for that question.
All right, Doc. The one last question, Doc, for this segment. Is it true that leptospirosis can cause abortion?
Yes, yes, it does can cause abortion, especially maraming species po na pwedeng tamaan ng abortion ay ng lepto, katulad po ng baboy. Baboy, nagkakalepto din po yan eh. So may mga bakuna rin pong binibigay para sa baboy. At many other animals. And one of the signs, kapag buntis ang aso, nagkakalepto po. Okay? Once na tinamaan po kasi yung kidney nyo, yung liver nyo, a lot of complications happen. And a fetus inside the uterus gets affected also. So, transplacental din po, katulad ng naitanong kanina sa isa sa mga tanong, na ipapasa din po sa ano to, sa mga puppies. Very highly contagious kasi nga yung fluid transfer inside the tummy, fluid transfer. Kung ano po yung kinakain ng aso, napupunta rin dun sa. So lahat po yun, blood exchange system, alam niyo naman po yun. I don't want to sound technical, pero nakakahawa po siya talaga and causes abortion. Totoo po yun.
All right. Thanks, Doc. So kanina we were able to discuss na zoonotic itong si canine leptospirosis. Doc, can you like give us a short reminder kung paano ma-prevent yung human risk dito sa canine leptospirosis?
Okay, now I know this also poses a problem to us, hindi lang po sa mga aso natin. Okay, so the most of the problem is, syempre, kailangan naman talaga maglinis eh, di ba? So this is very, very obvious. Okay, whenever, most of the time kasi ang problem pagka binaha, magiging madumi na yung area mo, you have to really clean it. You have to disinfect, okay? You have to separate your dog, lalo na if your dog is infected with lepto, magsished siya eh. So, masished niya yon through the urine. Pag nagwiwi siya around your house, you're exposed. Lalo na pag nagbaha, tapos merong open wound yung feet mo or kung saan man, may sugat ka, dyan ka po mahahawa eh. So, you have to really isolate your dog. And better to bring it to a vet. Iko-confine po. Doon na lang siya. Para meron siyang quarantine and isolation. Kasi po, itong sakit na to, tandaan niyo po, nakakahawa sa tao. And mahirap pong pigilin ito. Ngayon, pag hindi niyo napigil, pati po kayo mahahawa, lalaki po yung problema sa pamilya ninyo at sa lahat pang mga taong kasama niyo sa bahay. So, you have to really be careful about this. Clean, disinfect, okay? And isolate, quarantine the dogs that are infected. Okay? Bring it to a vet. Pinaka-importante po yun. Okay? Now, you know this already. I don't have to remind you this, syempre. May COVID pa rin po ngayon. And we should always practice, not just for COVID, you should practice washing hands, alam niyo naman yun. Kasi hindi lang COVID po naman yung ating iniiwasan dito eh, di ba? What we try to avoid is other viruses that can affect humans. Okay? So you have to always consult your doctor. Katulad ng mga aso nyo, you would always consult us, vets. You yourself, once you are exposed, since your dog is already infected with lepto, you are exposed to the problem. So you should right now consult your physician. Magtanong po kayo sa doktor kasi hindi natin alam eh, baka mamaya eh, bigla na lang kayo lagnatin because of that. And lepto is also a serious problem in humans. Thank you, Doc.
All right, Doc. Thank you. And I think that ends our discussion for canine leptospirosis. So for all of you guys, vaccination is a must. Sinabi ni Doc Ronald kanina. Sinabi rin ni Doc Omar. Sasabihin ko rin, pero vaccination is really a must. So, schedule your dog's vaccination now and check out Doc Jomar at Consult a Vet Animal Hospital. Okay, for all the consultations that you want to know about your pets, you can check out him on his clinic at Consult a Vet Animal Hospital. Right, Doc Jomar?
Yes, thank you to everyone. We have a new number. Actually, I'll just mention it here because this is an old number that we changed. I have a practice. It's called Consulta Vet Animal Hospital. It's in Tandang Sora, Quezon City, and in Capitol Hills Drive, Quezon City. The number you should call is 73409515. Okay, I'll repeat that. It's 73409515. Okay, we have a team who can help you out with your problems with your dogs, especially right now. I have a Facebook page and a Facebook group. It's called Consult a Vet. You can ask questions 24/7. I'm happy to answer all your help, all your questions, and we're glad to help. Again, let me thank you to Pilmico and Maxime for this show, Maxime Talks. I'm very excited to always share information for you on the next topics regarding your pets. We have a bunch of episodes in line for you that it's very informative. I'm very glad and thankful for the sponsors of this show, this webinar regarding your pets. Thank you, everyone. Thank you.
All right. Thank you, Doc Jomar. So before we end this, I would like to open the segment for online consultation. So we have gathered comments or questions from the comment sections that they needed answers or advices from you, Dr. Jomar.
Yes. If you have questions, just send it in to us. I'll be happy to answer it. Okay.
All right.
Okay.
So, Doc, my first question from Sir Toshiro Taipei. May home remedy po ba ang sakit na canine distemper and canine leptospirosis?
Yes, actually, first of all, before you do a home remedy, kasi a lot of people want, alam ko naman po na syempre nagtitipid tayo, lalo na ngayon. Pero kailangan po maintindihan nyo muna yung sakit eh. Kailangan nyo maintindihan na hindi po lahat. Example, bibigyan ko po kayo ng example ha. Ang COVID po ba may home remedy? Di ba? Wala po. Di ba? Wala pong home remedy ang COVID. Kaya pagka kayo po ay nagka-COVID, this is a very exaggerated example. Why? Because I want people to understand that there are problems in dogs and in cats na wala pong home remedy. Okay? Meron pong home remedy pero kailangan maintindihan nyo muna yung sakit para mabigyan po kayo ng advice ng doktor sa tamang gamot. Okay? Yung virus po, canine distemper, wala po siyang gamot talaga eh. Supportive treatment lang. Para po, pag yung virus tumama po sa aso ninyo, babaksak yung immune system niya, hindi pa po napapasok lahat ng mga iba pang sakit. Okay? Pero yung mga gamot po na yon, kailangan manggaling sa doktor. Kayo po lang ang magbibigay, tuturuan kayo. Okay? Kung home remedy lang po, kunyari yung mga natural remedies, halos wala pong gamot na natural remedy against a virus. Okay? So, supportive treatment po yun na manggagaling sa doktor. Ituturo lang po sa inyo. Pagdating naman po sa lepto, ganun din po yun. Meron din pong mga gamot na ipe-prescribe yung doktor. Tapos, doon nyo po itatanong kung ano yung pwedeng alternative medicine na pwedeng ibigay doon. Okay? Dahil po malubha itong mga sakit na ito, hindi po ito basta-basta gagana sa mga halaman, yung mga natural remedy. Dahil po malubha yung sakit eh. Lalo na pag example, yung canine distemper, meron po siyang seizure. Umaakyat nga po sa brain eh. Di ba po? O isipin niyo po, anong natural remedy? Ano po ang home remedy para doon? Wala po. Walang home remedy po doon. Okay? Kapag nanilaw na po yung aso ninyo, di ba po, mahihirapan po tayo magbigay ng home remedy para mawala yung paninilaw kasi late stage na siya eh. Yun po. Kaya, I'm not saying na walang home remedy. Meron po. Pero hindi po sa lahat ng pagkakataon. Kaya kailangan, kumonsulta kayo sa veterinaryo para maipaliwanag po ng maayos yung mga dapat yung ibigay kung pwede po yun o hindi. Okay, tutulungan po kayo ng veterinaryo. Salamat po. Thanks, Doc.
Right, Doc. So we're down to the last question for this segment, no? From Sir The Answer Kanyada, how long is a dog contagious with leptospirosis?
Naku, that's a very good question. Thank you, Mr. Kanyada, no, for that question. Mas napakaganda nung tanong mo. Kailangan malaman ng maraming tao to ngayon eh. Okay? There's a study that they did, okay, na nagsished po yung asong infected with lepto for 6 months. Okay? Dahil pag nagwiwiwi siya, habang gumagaling po siya doon, infected pa rin siya ng lepto, nagpo-produce po ng leptospirosis pa rin sa katawan niya eh. Okay? Ngayon, sineshed niya yun sa wiwi, sa urine po. Okay? It can still infect for the duration of 6 months. Kahit magaling na yung aso nyo. Kasi yung leptospirosis, hindi yan basta nauubos sa katawan eh. Hindi yan nauubos sa katawan. Kaya nga nagtitreat ka pa rin after 6 months. After gumaling na siya, 6 months, tuloy-tuloy pa rin po yung treatment ninyo. Para hindi kayo nakakapag-shed ng marami kasi nagsished pa rin po kayo for the duration of 6 months. Marami pa rin pong nahahawa. Kaya nga ina-isolate eh. Kaya po kina-quarantine para hindi mag-shed. And I want you to be careful with that kasi nakakahawa po sa tao, katulad na sabi ko kanina. Okay? So, be careful with this. Thank you, Doc. Thank you, Mr. Kanyada, for that question.
Yes, thank you, Doc. So yeah, guys, to keep posted, and of course, for your daily dose of pet wellness tips, please like and follow Doc Jomar on his social media accounts at Doc Jomar Vet, right, Doc? And of course,
Yes.
keep updated on all the promos, activities, and all the activities of Maxime. Please like us and follow on our own social media account at Maxime. All right. So please, guys, we are all inviting you to answer the feedback form posted in the comment section. And of course, two of you will be lucky enough to get a chance to receive 1.5 kilogram of Maxim Elite. And of course, 500 pesos worth of clinic or pet shop services on the clinic or pet shop of your choice. So right. So for all of our online shopaholic pet parents, we are still on sale on Lazada and Shopee. So please check on all Maxime and Maxime Elite products and enjoy your 15 to 20% discount. So what are you waiting for? Log in to your Lazada and Shopee account and start shopping for Maxime. All right. I think this wraps up our second episode. No? So this has been a very timely and meaningful topic to discuss, especially on a rainy season like this. We really hope that you guys were able to get information about distemper and leptospirosis, and we really hope that we were able to share enough resources for you guys. Let us all be informed about these dreaded diseases because lamang ang may alam. So as veterinarians, it is part of our duty to teach and share basic information about taking good care of our beloved fur babies. So thank you guys for tuning in. And of course, let's all thank Dr. Jomar Castro for being with us again today and for all his thoughts and insights about distemper and leptospirosis. So Doc, any few parting words for our pet parents here?
Again, thank you for watching. I hope to see you guys also on our next episodes. We will be discussing more on the problems of dogs and cats. And I'm very, very grateful for this show, for this webinar. I'm glad that I can share information to you through the help of Maxime, this show, Maxime Talks. And Dr. Raniel, thank you to you and to the sponsors, Pilmico and Maxime. Thank you very much.
All right. Thank you so much, Doc Chomar. So, dearest pet parents, if you still have questions about our topic for today, you can still put them all in the comment section and we will answer them as soon as we can. All right. So, once again, thank you for tuning in and joining us in today's episode of Maxim Talks. This has been your host, Dr. Renil Montero, reminding all pet parents out there to always do good for your doggos. All right. Bye bye.